The merger that formed Ballad Health is subject to intense state scrutiny.
It is, and tonight for the first time we're hearing from the man whose job it is to make sure that the hospital system follows all the rules.
I'm independent of Ballad Health.
A point Larry Fitzgerald clearly wants to emphasize because essentially his job is to look over the shoulder of Ballad Health Management to make sure they live up to their end of the bargain, the state's first ever Certificate of Public Advantage. That's the agreement that allowed Mountain States Health Alliance and Wellmont Health System to merge to form a Tri-Cities healthcare monopoly.
Part of the agreement is that there would be an independent person who would verify that they have in fact done what they agreed to do, and that's my role.
Fitzgerald said he's focused on ensuring Ballad improves population health, provides significant amounts of charity care, and reins in the cost of care it provides to the public. And if Ballad wants to significantly change the type or, say, the location of care it provides, that request has to go through him.
And there is criteria under which that approval would be granted. Cannot reduce service, can't reduce access, and the impact on employees. Those are the three major areas.
Fitzgerald says Ballad already asked to close its heart cath lab at Indian Path Medical Center and move it to nearby Holston Valley Medical Center, a request he recommended approving.
So to your knowledge, that's the only sort of facilities request that you've had to deal with?
It is.
Fitzgerald lives in Nashville, where he'll report directly to the Tennessee Commissioner of Health and the Attorney General once a month. When he's working in Johnson City, his office is here at the Ballad headquarters in a third-floored conference room.
Would you feel comfortable, if need be, to drop the hammer and
Absolutely.
say no?
I'd either do that or resign.
And if you are approached with a plan that you feel is in violation of the COPA, do you feel free to be able to look them in the eye and say no?
Yes, but it's even better than that. What I have found with Ballad Health is they have no intentions to do that. Actually, I've been surprised at the attitude of Ballad Health. It starts with Alan Levine and his whole staff. They are committed to complying with the terms of certification. It is Ballad's intent to comply with that both technically and emotionally.
And this note, Fitzgerald told me he's a contract employee of the state. He works about 1 week a month monitoring Ballad. He's paid $250 an hour, and today the state said Ballad Health is required to cover the cost.